orthopedics. Orthopedic conditions involve injury and disease of the bones, joints, and the related structures that include ligaments, tendons, and muscles. The severity of the injury determines the extent of the involvement of those supporting structures. Orthopedic conditions can be caused through a variety of circumstances and disease, which are a traumatic injury like an MVA, which is a motor vehicle accident, arthritis, rheumatic diseases, and fractures. So we're going to get into etiology of fractures, osteoarthritis, and osteoporosis. Fractures, they're caused by trauma or disease of the bone or joint. Two key critical factors involved in determining a fracture include the amount of force applied to the bone and the strength of the bone. There are high energy forces that occur from an MVA, while the low energy forces can be experienced in a fall or chronic stress, as seen in long distance runners, like stress fractures. Second determining factor for determining a fracture is the bone strength. The age of the person, size of the bone, health are key factors that can negatively affect bone's density, elasticity, and supportive structures, thus making the bone more vulnerable to those fractures. And as you can see on the bottom right, we just have a pathological fracture. It's caused by weakening of the bone from another disease. So you have the cyst right here, and that will affect the strength of the overall shoulder area muscles. So you got your humerus and even your scapula. Next, we're going to get into osteoarthritis. It's also referred to as a degenerative joint disease. It's a non-inflammatory joint disease that results in deterioration of articular cartilage and the formation of new bone or osteophytes on the joint surface. With these changes, the results often involve pain, joint edema, and impaired participation in life activities. It is the most common joint disease of the upper extremities. Osteoarthritis does occur at the knee, and this causes the most disability as it impacts someone's ability to walk, go upstairs, and participate in work and leisure activities. Many people seek hip and knee replacements due to osteoarthritis to return to their normal living with a pain-free lifestyle. And as you can see here, we have the osteoarthritis of the hip. You have the decreased joint space that we have here around that bone, and then we have the exposed bone with the worn cartilage around it. Now we have osteoporosis. If you see the woman, that just kind of helps you realize it's more prominent in women, unfortunately. It's characterized by low bone density and deterioration of the bone. And it's most common in post-menopausal women due to the cessation of estrogen production. And the most common sites for these fractures include the vertebrae, the wrist, the hip, and the pelvis. Estimates say that 50% of all women and 25% of men aged 50 or older will experience a fracture due to osteoporosis. All right, now we're going to get into incidence and prevalence of fractures, osteoarthritis, and osteoporosis. So fractures. Unintentional falls are the leading cause of non-fatal injuries across all age groups in the United States. Most common fractures resulting from falls are those of the spine, hip, forearm, legs, pelvis, pretty much everything, unfortunately, of the upper extremities and lower extremities. Falls are the leading cause of fractures in older adults, and women sustain 80% of all hip fractures, and they are primary causes of disability and mortality in older adults. 20% of the patients die within the first year of sustaining hip fractures. And some people may need adaptive equipment as they are less likely to return to their previous functional level. A trial showed that people who received OT were more likely to return to an independent living situation and less post-operative care. The OTs are charged with promoting life participation and well-being among individuals recovering from fractures and orthopedic conditions. Osteoarthritis. It's one of the leading causes of disabilities, impeding people's capacity to engage in meaningful and necessary daily occupations. 52.5 million people have arthritis worldwide, and 27 million over the age of 25 have osteoarthritis. Osteoarthritis affects the knee, distal IP joints, proximal IP joints, and the first metacarpal joints. Osteoporosis. According to the National Osteoporosis Foundation, 10 million people have osteoporosis, and of course 80% of those are unfortunately women. Early signs of osteoporosis seen in younger women in the form of osteopenia, and osteopenia is actually reversible. Once it gets to osteoporosis, unfortunately you have to live with that the rest of your life. Because of this trend emphasizes the importance of prevention and lifestyle management, because once it progresses, as I said, it is a irreversible degeneration. And as you can see, we have just a different charts to show you. Normal bone density, as it gets to osteopenia, you start to see a little bit of that mass gone. And then osteoporosis, you can see it's pretty much to the point where there's no return. Now we'll get into signs and symptoms.
So we're gonna get into signs and symptoms. So we're gonna first start off with fractures. So fractures are one of the most common types of orthopedic injury, typically caused by falls. Most apparent with elderly people. Closed fractures do not break the skin. When you have an open fracture, that is when the bone is protruding and broken through the skin. Green stick fractures, which are more common in children, is when the bone is not quite fully developed, it's still soft and pliable, so it breaks on one side and bends on the other. Hip fractures are also quite common. They involve proximal femur becoming separated from the joint capsule of the hip, and they can be from aging and falls. Humeral fractures are another common fracture. Those are due to increased aging population and sports injuries, usually from a fall on an outstretched hand. And then lastly, you have Volkmann's ischemic contracture. That is a deformity that causes shortening of forearm muscles from injury to muscles and nerves of the forearm. This can cause a claw-like deformity in the forearms, hands, and wrist, and you get a lack of blood flow to the forearm. Alright, so these are just some examples of different types of fractures. So the first one, you have your green stick fracture that we just talked about. Hip fracture, this is Volkmann's ischemics. As you can see, you have wrist flexion, forearm pronation, elbow flexion, and then you have the IP and MP, IP flexion and MP extension. And then this is going to be a humeral upper arm fracture right here. Alright, so signs and symptoms of osteoarthritis. Symptoms are pain, inflammation, stiffness and tenderness of joints, limited range of motion. And this is caused by the wearing down of protective tissue around your bone joints, which is cartilage. And movement from physical activity can be very effective. So the more you move around, just kind of being sedentary does not normally help the situation. And then weight loss is also effective because you have less weight bearing on your joints. Right. And then osteoporosis, signs and symptoms. So this is progressive and gradual deterioration of bone. So like Randy said, once you're at this point, there's really not much you can do to reverse it. This leads to weak and brittle bones, which increase the chances of a fracture. It's most common in women over 65. Usually asymptomatic unless there's a fracture. And compression fractures of the spine can lead to kyphosis, which is hunchback, and lordosis, which is more sway back. And osteopenia is a precursor to osteoporosis. It eventually worsens over time without treatment. Alright, and then course and prognosis. So for fractures, different factors will determine the outcome. It depends on the fracture type, like if it's open or comminuted. Hopefully I said that right. That's comminuted is when it's just kind of the bone is broken into smaller pieces, and that's usually more severe. For best healing results, the affected site should receive adequate circulation and minimal movement. So these are the 5 healing stages of fracture. So the first one is hematoma, so that's when you have the blood vessels start to kind of seal the area of the fracture. Then you have the increased fiber cartilage to promote the bone stability. And then you have a callus that's going to impact the outcome of the healing. And then you have ossification, which is hardening of the bone. And then the last step is going to be remodeling of the bone itself, and that can take up to a year. Okay, so the most common type, now we're on osteoarthritis. The most common type is the idiopathic arthritis. This is also known as primary osteoarthritis. No specific known cause. This can cause bone spurs on proximal phalangeal joints, Bouchard's nodes, and that's on the DIP And then we have the Herbert's nodes. So with progression, these joints on the hands and feet have less function and mobility. Most cases are fairly stable, less than 5% need surgery, and this can happen at any age. All right. So so we're continuing, of course, with prognosis, osteoporosis. So this begins, again, like we mentioned, as osteopenia. Bone loss occurs. The body is not able to regenerate new bone growth to replace old bone. This can progress if not treated in a timely manner, and good lifestyle changes can slow this process, such as weight-bearing exercises to strengthen bone, as well as a calcium-rich diet. Lifestyle changes can help to maintain, but not reverse the condition.
Okay, so for the diagnosis of these three, so first the physician will evaluate and acquire signs and symptoms from the patient, when most likely he'll refer the patient to radiology, and then the radiologist is able to determine the degree and the classification of the fracture, as well as to evaluate other associated findings like pathological fractures, like bone weakened by a tumor. And so this is usually confirmed by an x-ray, and if the physician just feels like further testing or other studies need to be done, then he will refer to what is needed. So for example, with the distal radius fracture, that's usually easily diagnosed with an x-ray, but for a scaphoid fracture, it can be a little bit more challenging, so therefore a CT scan or a bone scan may be required. For osteoarthritis, the diagnosis begins with a clinical exam when patients complain of pain, stiffness, and swelling, and it can occur at any joint. And then the acuteness of osteoarthritis is diagnosed by x-ray or radiographs, and these usually display the amount of the joint damage taking place. For osteoporosis, that's typically identified with the bone mineral density scan. And of course, osteopenia, which is the beginning of it, is evident in the bone scans, and it's used to confirm the diagnosis. It's also diagnosed in health screening and when an adult has several risk factors, and that includes being a female, smoking, excessively drinking, and having a low body weight, and also if you've had a parent who's had a hip fracture due to osteoporosis. With the medical and surgical management for these three. So for orthopedics, it just varies depending on the specific condition. Some require over-the-counter medication, some splinting, some home exercises, while others may require surgery. And there's many fractures, but one of our most common ones is the hip fractures, as we mentioned. And usually those require surgical intervention, and the surgery just depends on the severity of the fracture, the pre-fracture functional level of the patient, the age of the patient, and then also the presence or absence of comorbid conditions. And also the surgeon will determine whether you do need it or not. So patients who have a more active lifestyle prior to a fracture, of course, will have less complications and more positive results after surgery. The goal for surgical intervention for the hip fracture is to align and immobilize the fracture to allow normal healing. So for hip fractures, they are treated with either closed reduction and immobilization, or open reduction and internal fixation. For closed reduction, it involves realigning the fracture fragments through manual manipulation or traction with general or local anesthesia, because this can be really painful. Immobilization can be accomplished through casts, traction, splints, or braces. And for open reduction, it involves opening and reducing the fracture site. Internal fixation is usually done after the opening reduction, and it involves securing the fracture with pins, rods, plates, and screws. We also have distal, radial, and humeral fractures, which may be reduced or realigned manually or as well with surgery. And as Sarah mentioned, one of the fractures that we have is a closed fracture, and those can be reduced manually or immobilized with a cast. And for the fractures that are unstable and cannot be manually reduced, then those will require surgery, and this is called an open reduction and internal fixation. So the immobilization phase for each fracture just depends on the type of fracture. So for example, the distal radius fracture, that the immobilization phase for that would only be from 1 to 6 weeks. Where a non-displaced scaphoid fracture typically takes about 8 to 10 weeks. And then a proximal scaphoid fracture that requires a thumb cast. So it goes from a long thumb cast to a short thumb cast, and then that can take from 6 weeks to 6 months. So arthroplasty, that may be indicated in joints that have severe pain or degeneration that significantly limits participation in daily activities. Arthroplasties, or otherwise known as joint replacement, may be done in hands, shoulders, and other joints, but the most common ones are the hip and the joint, as they're weight-bearing joints. And then also, as mentioned before by Randy, total hip replacements. Those are done if there is severe arthritis causing pain and stiffness that limits the participation of the patient's life in their daily activities. And so also when there is damage to the acetabulum, the socket of the hip bone or the femur during a fall. And arthroplasties usually last from 10 to 25 years. After having a total hip replacement, it's important that the patient follows several precautions for about 6 to 8 weeks, and those are, for example, no hip adduction, no rotation of the leg, and no hip flexion that's supposed to be flexion, not flexion, beyond 90 degrees. And then depending on the severity of the condition, the surgical approach and procedure, and the orthopedic surgeon may require weight-bearing precautions for the patient to follow after a total hip replacement. So for the knee, the conservative treatment is the first line of treatment, which usually begins with over-the-counter anti-inflammatory medications and heat and ice. If the pain and functional limitations progress, the patient's PCP and rheumatologist may prescribe medication to effectively control the arthritis. And then if that doesn't work, then the patient may be a candidate for partial or a total knee replacement. And for that, it is important, so for the total knee replacement, it's also involves the resurfacing of the entire knee replaced by a plastic or metal prosthetic component. After surgery, it is important as well, like the hip replacement, to begin the rehabilitation process, which involves pain medication and early mobilization to strengthen the quadriceps, because usually your quads begin to lose their strength, and so also to prevent loss of range of motion. To maximize the result of the surgery, patient, as I said, as well with the total hip replacement, it's important that they follow several precautions. For example, avoiding placing a pillow under the knee while in bed, resting both feet on the floor while sitting to increase the range of motion, and weight bearing wearing an immobilizer to protect the knee joint until the muscle is strong enough to support it. So usually patients return to their normal daily activities after 3 to 6 weeks. For osteoporosis, it can affect any bone, but the hip and spine and the wrist are the most common ones for osteoporosis fractures. If the patient has serious osteoporosis fracture, then they most likely will require surgery, and the type of surgery as well will be depending on the severity of the fracture. So the majority of fractures occur in people who are 70 or older, and if they undergo surgery, it can take months up to a year to recover. The fall assessment and prevention is an essential part of managing osteoporosis, and there's exercise programs and home exercise safety precautions that lower the risk of falls. And so there's also exercises that can enhance the bone strength. For example, weight-bearing exercises like jogging, skipping, stair walking, and progressive resistance training like lifting hand and ankle weights. And then based on the result of the bone density test, if the estimated risk for a bone is high, to break a bone is high, then the medications such as alendronate, isandronate, residuronate, and zoledronic acid will be prescribed to treat and prevent osteoporosis. If the risk is not high, medications may not be needed, and instead modifying risk factors for the bone loss and falls is the ultimate goal for safely minimizing the possibility of a fracture.
Okay, so this is the impact on occupational performance. Client factors are an important consideration when working with patients that have orthopedic conditions. Whatever the bone-related injury is, the main focus is to help them get back and be able to participate in their daily occupations like dressing, working, and leisurely pursuits. The circumstances surrounding an injury like a fracture or a condition like osteoarthritis can impact secondary injuries like malunions, which is when fractures don't heal properly. And then psychosocial involvement like increased depression or anxiety. Therefore, it is important to conduct a thorough history regarding the injury in order to better treat them. So, like asking, or if a patient sustained a fracture, is it their first fracture? And then trying to see if their family has a history of osteoporosis. And then background info can help guide their treatment. So, educating them in preventative care. Orthopedic conditions can compromise participation in areas of occupations like ADLs, IADLs, sleep, education, work, play, leisure, and social participation. The degree of impairment depends on the severity of the injury, like if it was an open or closed fracture, because opens, they're going to be more complicated. And then the location of the injury and the client's previous health status and their age. Most commonly associated client factors regarding a person's participation in occupation include, these are the two main ones, body functions and body structures. So for body functions, it's sensory functions like pain, balance, and then related to their movement, mental functions, and then skin can be one if it's an open fracture, and then structures related to movement. And that's just a chart. The neuromusculoskeletal, can't say that. That's like your main one. So joint mobility, joint stability, muscle power, muscle tone, muscle endurance. Those are the main areas. Joint mobility, stability, and alignment are directly affected by fractures or conditions like osteoarthritis. So in the case of fractures, it's necessary to reduce or realign them in a timely manner. For example, a woman with a distal radius fracture may initially have difficulty fulfilling her motherly role with an infant until the pain and swelling are reduced and the fracture stabilized. She may be unable to lift her baby and have difficulty doing things such as changing diapers. So the sooner she begins treatment and the recovery process, the sooner she can fulfill her role of being a mother. And then it's important, obviously, for the patient, they need to be motivated in their treatment as well. And muscle strength and endurance are often affected by orthopedic conditions as a result of immobilization of a joint during recovery. These limitations may also be caused or worsened by disuse of the involved extremity. So a person will often hold their involved extremity in a dependent or guarded position and refrain from using it. That further compounds the patient's symptoms and often leads to loss of range of motion, strain, and pain in other joints. Limitations in muscle strength and endurance directly impact their performance or participation. So you do want to motivate them to try and use their affected, even if they're afraid of removing it. Joint pain, inflammation, and limited range of motion from osteoarthritis can affect participation in daily life activities as the integrity of the bone is compromised. As such, an individual may require the use of adaptive equipment to help with dressing and grooming. So orthopedics can affect your areas of balance, sensation, and pain. When recovering from a total hip replacement or hip fracture, an individual may have all weight-bearing precautions, and they can struggle with their balance, like moving around in the bathroom or getting dressed. So they might need to modify how they do certain activities in order to prevent a fall, especially if they're older. It's a huge thing, is fall prevention. So pain is a common sign of injury. It will vary depending on the person and their injury, and if they had any complications or other issues going on. Sharp or continuous pain may affect their ability to complete daily tasks, and you should always assess the patient if they have pain. In addition, functions of the skin may be impacted by orthopedic conditions. So I think we talked about compound fractures, but they're also known as open fractures, just FYI. And they can result in a wound that's at risk for infection. This type of fracture will involve more medical management, and so it might limit their ability to participate in a variety of occupations due to their pain and the wound care. Mental functions such as self-concept, motivation, and interest may also be affected by their condition. A distal radius fracture may be present with skin changes, edema, or severely limit movement in the fingers. So as a result, the person may have difficulty doing tasks like dressing, grooming, writing. The inability to perform these daily tasks we take for granted can impair their self-concept and affect a person's motivation, like if they were to withdraw from activities they are normally interested in. As OTAs, it's important to assess all parts of the patient, both their physical and mental aspects. This ensures our standard of practicing holistic treatment.
All right, we're gonna get into the quiz questions now. So quiz question 1, don't worry, not drawing any sticks. Just get it together, we'll figure it out. All right, the OT is working with a patient who can only use one arm. The other arm has a split due to a recent fracture. The fracture had an incomplete break of the bone, indicating this type of fracture would be a blank fracture. So we have comminuted fracture, hairline fracture, green stick fracture, or spiral fracture.
And Miss Joseph is gonna answer that question.
Who is?
Miss Joseph.
You said? Correct. It is a green stick.
Yay!
Akona is treating a patient who had a total hip arthroplasty 2 days ago and is expected to be discharged to home in 2 days. On what areas is it most important to focus? A, cognitive and perceptual function. B, work, self-care, and leisure skills. C, upper body strength, range of motion, and coordination. Or D, adaptive equipment and caregiver assistance.
And Miss Marquez is answering that one.
Okay, Dakota is expected to discharge home in 2 days. On what area is most important? D?
Yes.
Wait, what did you say?
D?
B is in baby or D
I
is in
heard
dog?
D.
D is in
It's
dog.
D.
D.
My glasses the screw fell out of the frame. And look at this, I can't even. I'm just telling you, this is, okay.
All right. Question 3. Which of the following is the most important adaptation to recommend to an individual returning home following a total hip replacement? Move items from high cabinets to lower locations. B, purchase a raised toilet seat. C, place high contrast tape at the edge of each step. Or D, install a handheld shower head. Total hip replacement.
Oh, I'll let you guys decide who's gonna answer that one. Oh, pull a stick, you said no, pull a stick. Yeah, see how we feel, pull a stick. Who is it?
Ms. Watson.
My name is not even in there.
Okay,
It's
so,
a hip replacement.
total hip replacement.
B.
It's because they can't
They
bend
can't.
more than 90 degrees.
Yeah, they can't bend their knees, so you gotta have it raised.
Would D also know?
Well, I think it's just referring to the most important. I mean, they're all technically important, but for them, if you have
What's
a,
the best choice?
what's the best choice?
There's
So-
more than one right, that's
Yeah,
why.
they're all
It's like
correct,
you're not
essentially,
the
but you're looking, well, if you're going home, and we all talked about, having your independence. I mean, you don't want anyone helping you use the restroom, you wanna make sure that's something you can do on your own. That would be the best choice. I mean, of course, we're gonna have to get all these adaptations for them, but for what this person needs to be a little bit more independent and have that own self-care, you would choose to have that raised toilet seat.
Yeah, let me answer that. That's a good question, because the focus on it, and this is like a NBCOT style question.
All of them are.
They're from the purple
Oh,
book.
Yeah.
okay, well, okay, number one. Okay, because when you look at that question, our first train of thought was, well, they're gonna need all of those.
Yeah.
They're gonna need all. So that means that if they're gonna need all of them, what do? You go back to the question and say, there's gotta be something in the question that sets the answer off. And it is the best, what is it?
The most important.
Most important. Then you take a look at A, B, C, D. And you're right, that raised toilet seat isn't that more important than who has who's in the cabinet? I mean, really? Yeah, I can see between B and D, you know how you guys get down to two answers? And they both look good, and install a handheld shower head